Hi, I'm Katrina Mosier. I'm a registered dietitian with Partnership for Health, and today I'm joined by Jason McCoy, our tobacco prevention coordinator. Jason, would you give us a little bit more information about what you do with Partnership for Health?
Absolutely. So as the tobacco prevention coordinator, I work with our communities to reduce tobacco use by our youth. And that takes two different tactics. One is I work with our schools to provide education to the teachers, and I also work with youth groups to help provide peer education. And then I also work with our communities to pass stronger policies that would reduce youth access to tobacco.
Very good. We know that vaping in our schools is on the rise. The Surgeon General even calls it an epidemic. Can you elaborate on what that means for us here in Greater Minnesota?
Absolutely. So our latest Minnesota student data that came from the 2019 survey shows us that 1 in 4 of our teens are actually using some form of tobacco. That's vaping, and it goes up even higher if you include cigarettes and cigars, but vaping is the big one. It's over 26%. And so here in our area, here the Partnership for Health works in, we're seeing in our schools an even greater rise. So we have school use of 32% all the way up to 52% in some of our schools, meaning more than half of our students are actually vaping in some of our schools.
Wow, that's really impressive and frightening.
Yes.
What can we do to help prevent our youth from using vapes?
Great question. So the number one thing I would say, if you're a parent, if you work with teens, talk to them about this. You think about how much social media impacts our teenagers right now, and that is where the tobacco industry is reaching them with news and information, misinformation about vaping. So talk to your kids early and often about vaping. I guarantee you they see it. Hopefully they've chosen not to use it, but do work with your teens and talk to them about it. And the second thing is these stronger policies that we work on. For example, Tobacco 21 is a policy that we've worked on quite extensively in our area and across the state. And this reduces the ability for a teenager to get tobacco. How? Well, that's really interesting. Our 18-year-olds can currently purchase tobacco. And so our kids know if they give money to an 18-year-old, they can purchase it for them. So it's become a point of peer pressure for our 18-year-olds, and it's also become a way that some of them have been using it to make extra money. But if we raise the age to 21, we see that connection to tobacco get completely cut off for our kids.
What specifically has happened with the Tobacco 21 efforts in Wilkin counties and Otter Tail County, some of the local
Absolutely.
areas?
So right now, Minnesota has had 55 municipalities pass Tobacco 21. We're proud to actually have had the first county. Otter Tail County was the first county to pass a Tobacco 21 ordinance. Wilkin County has followed them, and now Fergus Falls has as well. And we have other municipalities that are currently working on it in our region.
Very good. So if a city or county wanted to work on T21, what resources are you able to provide to them?
I would be your first resource. As a free resource, mind you, I can come in and I can help provide education as to why the policy is important. We have access to the Public Health Law Center for free, so you can get free legal advice and draft ordinances made for you to help. And then personally, I can help rally the community around the support of teens not using tobacco, right? That's what it's all about. And so I can help many different ways with helping with that.
Great. Well, thank you for being here today. Thank you for the work that you're doing, and we look forward to seeing more progress in this area.
Thank you.